Hello everyone, this is Bob Brown with Community Coronavirus Update number 77. Today we'll talk about some promising trends, the canaries in the coal mine, and some vaccine myths. Hopefully the trends will keep being good enough that I won't be recording these every week. I'm hoping every 2 to 3 weeks, but we'll see what happens. So the good news is numbers continue to stay pretty low. I was hoping they'd actually get down to this green area here, but we have a little bit of a pause. Could be a rebound from the confusion around when you should and should not wear a mask. So I suspect we may get a little rebound of some cases of people throwing off their masks and having pizza parties with kids or something like that. We'll see what happens in the next few weeks, but overall though, still numbers are much lower than they had been, and so this is promising as long as we don't get much of a rebound. State of Nebraska, pretty much the same way, just like Lincoln, Lancaster County. Almost everybody's down in the yellow level here, so very promising for Nebraska at this point. If you actually go to the COVID Act Now site, actually Nebraska is number 5 for the 5th lowest rates, which is really, really good. If you look, though, there's one concerning factor in this, though, is that although our numbers are the lowest, our positivity rate's higher. And that what this is usually a tip-off that a lot of people who are positive aren't actually getting tested. And so without a test positivity in the 1 to 2% range, it means this might be a falsely low. Still pretty low, though, and overall pretty good. Vaccination rates were pretty good. We're about middle of the pack. We're not near as good as some other states, but we're not near the bottom either. So we're kind of middling for vaccination rates, but overall not too bad. And so overall promising trends. As far as the rest of the country, I'll keep looking at this COVID Act Now site and looking for any signs of some pop-ups. I think we'll have intermittent outbreaks in regions. You see maybe some hot spots in West Virginia, Northern Virginia, Northern Texas, for example. Hopefully those are pretty limited if we have enough vaccination rates to keep them limited. But I also would say that there's probably some canaries in the coal mine, and the states I'll probably watch out for most are Wyoming, Mississippi, and Alabama. You'll notice that their infection rates are actually climbing a little bit. They also have very low vaccination rates, which kind of set them up for another surge in the near next few months. So we'll just have to watch and see if anything bad happens there. So the good news is before something like this were to happen in Nebraska, we'll probably see it there first because they have much lower vaccination rates than us. One way to look at it, Mississippi, for example, is probably high risk. And one of the things that I think people need to get over is this idea that this coronavirus is seasonal. I don't think it is seasonal. I think people act seasonally, and that's why you'll see these differences. And so Mississippi, you've got a rising infection rate, a low vaccination rate, and I think some of these people who were infected last summer are probably not immune this summer. And so there's two myths I'd like to try to dispel. One is the one and done myth, and the other is the seasonal virus myth. So unfortunately, we're finding that once you get coronavirus, you are likely to get it again in the next 4 to 8 months if there's a new variant that sweeps through. And so Brazil, India, and other countries have learned this the hard way. So all these people who got infected in the South in the last summer surge probably are not immune to the new variants. And so what may happen again is that like I said, I don't think it's a seasonal virus. I think people act seasonally. So what happens in July and August in the South, well, it gets really hot and humid and everybody goes inside the air conditioning, and that's the perfect environment for coronavirus to spread. We've got a lot of the variants in the United States. So here in Nebraska, B117 is more than half of cases now, but we also now are up to 5 cases of the Indian variant. And so these are more infectious, and the immunity that people got 6 to 12 months ago probably may not protect them against this. And so that's why I think you may start getting some reinfections and potential surges. And that's why we've got to watch the canaries in the coal mine. So again, watch those infection rates going up, and low vaccination rates is what sets you up there. And so there's things that will put communities at risk for outbreaks. One is that low community vaccination rate, which we're seeing, but especially in the deep south. The current rates of community spread kind of tells you where your fire might start from. So the lower that is, the better. But we have to be concerned about waning natural immunity and indoor unmasked gatherings of unvaccinated people. So those will all set people up for future surges, unfortunately. So good news locally here in Lincoln, Lancaster County. I actually think the Lancaster County Health Department's visualization of vaccination is one of the best I've seen, actually. I think it's a good color scheme. You can see who's had at least one dose, who's fully vaccinated. So this is sort of a leading indicator for what your vaccination rate will be in a few weeks. And you'll see that it looks like, above 65 will be well over 80%, which is really good to see. However, people need to realize there's also the converse. There's still a lot of these people who are not vaccinated, and it still is a lot of fuel for the fire to spread again. And so another way to look at it is to flip those numbers and say, really, although yes, we have a lot of vaccinated people in the older age ranges, less than 11, it's 11 or less, it's 100% unvaccinated. But here we have ranges of 40 to 77% unvaccinated. This is still a lot for the virus to spread. Some of these people got it, quote, in a natural way, but they're not one and done. They are susceptible in the near future if the B17 and Indian variants go through. So there is some risk there that people have to be concerned about. I've actually talked to some folks who seem to be a little confused on getting vaccinated. The good news is it's much more accessible than it used to be. So Hy-Vee, I think, actually has found the easiest. My daughter flew in from Dublin last week, and of course she was in Ireland for the year, so didn't get vaccinated. She got in Thursday night. We got on the Hy-Vee pharmacy app, clicked through, and had her appointment the following morning. And I just did this morning. And you only have to wait 2 to 3 hours to get a vaccine appointment. So if you go on that Hy-Vee pharmacy app, I just used the Google Maps, clicked book appointment, and clarify, of course, remind people you don't actually have to have insurance. They ask for your insurance card because they can bill your insurance. But if you don't have insurance, the vaccine is free, but that you can easily book an appointment in any slot, and you can actually pick which one you want, Pfizer versus Johnson & Johnson, for example. So this is a very easy way to get vaccinated pretty quickly with just a minimum of wait if you want to do so. So other things, I've actually seen some rumors around people falsifying vaccine cards, or talking about it anyway. As you can see, this probably wouldn't be that hard to falsify with Photoshop, for example. But I'd point out it has the CDC logo in it, and it is a federal crime to falsify a federal document with a good logo like the CDC logo. Here's the actual criminal statute, if you're curious, and I put a link in the notes section. And it's punishable by a fine or up to 5 years in jail. Also keep in mind this is a felony, and so if you want to have something like, say, a liquor license or a professional license, that actually may prevent you from having that. And so, although yes, in theory it wouldn't be that hard to falsify this document, the penalties if you get caught are pretty bad. So I wouldn't go there if I were you. Lastly, we'll just talk about some vaccine myths. A good article today in the Omaha World and the Journal Star with some local Nebraska physicians talking about the vaccine myths. People don't trust the government very well, so okay, let's have actual Nebraska doctors like Dr. Jessica Jones, an infectious disease physician at Methodist, going through these common myths that are really promoted by a small number of people. And if you understand the biology, these really don't make a lot of sense, but we'll just kind of run through a couple of them. One, the reality versus the myth. People say, "Oh, this was rushed through." Actually, the reality is the vaccine went through the same studies of other vaccines, but they were done in parallel. And so the reason it was done fast wasn't because any corners were cut; it's because the financial barriers were removed. And I've told people that's one of the smart things the Trump administration do. Warp speed, basically, it took all the financial risk and all the individual meetings out of the way. Typical vaccine process goes through stages that take years and years and years, mainly because of the meetings and the money discussions that happen between the stages. And what the federal government did is said, we're going to take the risk out of you. Go ahead and build your manufacturing facility today, and if it works, just go produce it and we will buy it from you. And so they took the financial risk. So actually, that's often the longest stage is Pfizer going to build all those manufacturing facilities until after all these stages are done, they know it's going to work out. What the federal government is, they just put the money up front, and so they did all these stages almost in parallel to each other. So it meant that you could get this thing, all the studies done in a year instead of doing it over 4 or 5 years. So it's the financial risk that sped things along. They literally did all the same studies with all the same numbers of people of any other vaccine. So this wasn't a rush job in terms of cutting corner. They just took the financial barriers out of the way. Another myth is that somehow it affects your genetics, and mRNA degrades quickly and it doesn't get into the nucleus, so it can't affect your genetics. And so diagram of a cell, the nucleus, your instructions for your body come from your DNA, which moves into RNA and then a messenger RNA. The messenger RNA goes outside of the nucleus, gets transcribed by ribosome, and it makes these proteins. In this case, for the COVID vaccine, this is the spike protein that is on the outside of the virus. All it does is transcribe that. So this is a piece of mRNA in the vaccine that gets in here and gets basically just transcribed to make a protein. It can't give you coronavirus because it literally doesn't have the full instruction set. It's only got the page of the Chilton's manual that says how to make a spike protein. So the only thing the mRNA virus can get your body to do is make that spike protein. Also, mRNA degrades pretty quickly. That's why the vaccine has to be frozen to such low temperatures. And this going from here to here is a one-way street. So the mRNA doesn't go back into your cell and make any edits to your DNA. It's a one-way transcription process. And so this is a very safe vaccine, partly because of this. Other common myths is the fertility myth, and oddly enough, that's a myth straight out of the Taliban playbook. One of the reasons we haven't got rid of the world of polio is that religious fundamentalists in the Middle East have put out a myth that the polio vaccine causes infertility, and so it's the same type of myth, and there is no effect on fertility of the virus, so that's a red herring. The other thing, people saying no, this is new investigational. New investigational where surprises are found post-release are usually between the 30 to 60,000 vaccinations that are in a phase 3 trial and the first couple million that are in the post-release period. We're actually over 160 million Americans already, plus all the other countries. There have been so many millions of doses given, and then the vaccine reporting system is probably the most robust ever in history. So this is becoming one of the most studied rollouts ever done. And so if there are any uncertain side effects, they're going to be very, very rare and pretty quickly caught because of the monitoring system. So this is not an experimental vaccine anymore. And I suspect within the next months, the vaccine will have the full federal authorization. It's just that some of that stuff just takes bureaucratic time. So hopefully this is helpful to you, kind of a shorter update today. Hopefully I'll only be doing this every couple of weeks in the future, but if they're helpful to you, the old ones are on healthylincoln.org, and the usual disclaimer that this is what I do for a living, but these are my opinions, not necessarily those of the folks I work with and for.